My name is Marla Salmon. I'm a professor of nursing, public health, global health, and public affairs here at the University of Washington. The conversation today is focusing on human rights in nursing. And I think those things are often considered to be separate. But from my perspective, if every viewer could walk away saying that it's fundamental to nursing, that human rights is a part of what we do, what we think about, and what we're committed to. So I think that when we think about human rights in the contemporary context, we think a lot about the things that we would do differently, the things that we want to do, but we don't often think about that nursing is actually embedded in human rights. The early nurses who literally in every country have fought for the voting rights of women, have fought for the rights of those who are vulnerable, have been the voice for others. Those nurses have been doing that for the last century and a half. I think that we've focused a lot in our education on the tasks, on the specific things that we do for one person. And in that regard, I think we sometimes forget that the person is there and the tasks become pretty prominent. But when you're actually practicing person-centered care, you have a compassion about what are those things, what are those surrounding factors that are creating the health or the lack of health of that individual. So for me, the tasks are secondary. And when we have an opportunity to help our nurses learn and continue to learn that it's the relationship with other that is where human rights sit. You know, I think it actually comes down to compassion and relationship. And we often get caught in the technology, caught in the rush. And if we can foster that among ourselves, as well as among those that we work with, the starting point becomes that patient, that family, that community. So you can't get lost if you stay in touch. You might be challenged to figure out what you're going to do, but you won't be challenged to know what the problems are. If you look at the presidents of the International Council of Nurses over those many decades and over a century, they've really represented every part of the globe. And you see that in terms of the emergence of leaders in Asia, in Africa, in the continents north, the continents south, and I think that that is a very strong legacy. But it's not a legacy that's easily embraced. It was always nurses on the front line who stepped forward. So every country, literally every country, has its example of nurses who have said, my job doesn't end with my shift. My commitment goes along with courage, and I'm here to serve. And you see it over and over again. When you think about the things that raise consciousness about human rights, first I think it's information. And I think it's understanding the connections between nursing and human rights, but it's also understanding the origins of our contemporary knowledge about human rights. So in 1948, the Universal Declaration of Human Rights was adopted by all of the member states in the United Nations. And that was the first global documentation of what are the rights for all people. And when we bought into that, not only did the countries buy into that, but every profession that has a social contract with a country, and nursing is one of those, has that contract to fulfill its obligation to the rights of the people that they serve. More recently, and it's been going on for a number of years, the Sustainable Development Goals the United Nations and the member states adopt relate very much to human rights. And that health was embedded originally in Article 25 of the Universal Declaration of Human Rights, and it stands front and center in the Sustainable Development Goals. So if we as professions and professionals don't have that sense of a contract with our countries and with the world to look out for human rights, then we really aren't doing our jobs. So I think there are many reasons why nursing is well positioned to be part of advancing the rights of people. First of all, we stand between and with patients, families, and the healthcare system. So we are that interface, and it's our responsibility, not alone, but it's our responsibility primarily to be that advocate for those patients and families, and to know them in ways that we understand what's really at the root of their suffering. And once we do that, we are approaching what I think is activism that makes a difference. So it's not only about understanding that patient or family, but it's also about giving those individuals voice. And voice is something that is often the first thing that goes when people are denied their rights. So we have the numbers, We have the education, we have the commitment. It gets daunting to think about really standing in front of forces that are much bigger than us sometimes as individuals, but starting with the power of one individual to make a difference for another individual is that starting point. And that in itself is empowering. You don't have to do it alone. And professional organizations like the member state organizations, as well as the International Council of Nurses, provide tools, they provide community, they provide access to others. So partnering is a key thing. Also understanding that while we are nurses, there are others who make a difference too, and partnering with those to reach across disciplinary boundaries, to reach across socioeconomic boundaries. That's how we empower ourselves to empower others. Traditionally, we've thought about how can we get people to come to us? How can we understand how we can make them be compliant, adherent, whatever terms you want to use. But basically it was, we're in charge. We're the ones who know everything, and you need to come here and to get what we have. Flip that. Real access is about starting with those individuals. It's about starting with what their needs are, what is the condition in which they live. We know that your genetic code is actually far less important to your health than where you live, where you work, if you can work, your own socioeconomic situation, the people that you're with. All of those things have much more to do with how healthy you are. So access is really about making sure that what we deliver to others is appropriate, it's affordable, they can actually receive it, it's sustainable, it makes a difference in their lives in ways that they care about. And it also makes a difference in the ways that they pass on from this earth. And I think that that's the connection that we need to have in terms of universal health coverage. How do you do it? A lot of it is about policy. How do you fundamentally shift a system? How do you engage in ways that get those policies enacted and those regulations and those recognitions that every person deserves to have adequate coverage? It's about activism. It's about partnerships about across sectors. But fundamentally, for me, it is about nurses never forgetting that their most important connection is with the people that they serve, and that they are the voice, they are the advocate, and they are the partner.